Good morning, everyone. It is 10 o'clock, so we will go ahead and get started as people continue to join us. My name is Jamie Watts. I'm the Director of Events at the Newcastle County Chamber of Commerce, and I want to welcome you today to our Getting Back to Business webinar. I am thrilled to have Dr. Jordan, the Medical Director for CareVio, Dr. Patel, Psychiatrist at Christiana Care, and Dr. Bauer, clinical psychologist at Christiana Care, with us here today. We're going to be talking about a few different topics, including employee monitoring, symptom monitoring, telehealth testing, as well as well-being in the new workplace, recognizing that things are really changing for people. There's some fear and anxiety, lifestyle stresses, and what leaders can do to show some empathy and support. Everyone is muted except for our panelists. So if you have any questions, please utilize the chat feature. And what we will do is ask questions towards the end. And now I'm going to turn it over to Dr. Jordan. Hello, Dr. Jordan.
Good morning, and thank you. It's really a pleasure to be with you all today. I am the medical director of the virtual primary care practice and of CareVio, and I think you can start my first slide. Yeah. Thank you. CareVio is a subsidiary of Christiana Care and is our population health and virtual care platform. Next slide, please. So the goal of the next 10 minutes is really to introduce CareVio COVID Employee Monitoring Program and show briefly how we are monitoring staff, caregivers, and employees during the reopening of business during the amidst the COVID-19 pandemic. CareVio Employee Monitoring Program involves both screening for COVID-19 symptoms and monitoring employees and patients who are COVID positive. The purpose of the CareVio monitoring program is to detect new onset of COVID symptoms in employees. It's also to provide on-demand physician access for employees with COVID symptoms and to determine after a virtual visit with one of our physicians if COVID-19 testing is required or is any other testing or medical treatment necessary. Our CareVio team both assists and coordinates any medical services that may be needed or required. The ultimate purpose of the CareVio monitoring is to help employees and our community stay safe by identifying potential cases, COVID cases early in order to help mitigate the spread of the virus. For COVID positive individuals in particular, CareVio monitoring helps identify and prioritize those folks who need an urgent virtual physician visit or immediate medical services. So next slide, please. So CareVio has been monitoring Christiana Care employees since the early days of COVID and continue to do so as we reopen our many services at multiple locations. Now, as you may be aware, we're a fairly large health system and we're currently monitoring over 6,500 employees, and many of those we monitor twice daily. We currently have multiple contracts with employers for monitoring services. Some employers are as small as having 6 employees, and most, I would say, are moderate, between 50 and 100 to 200 employees. So we are able to accommodate any size employer. CareVio uses bidirectional secure text messaging to communicate with employees when they develop symptoms, and that communication is performed by our CareVio certified nurses. There have been over 300,000 text messages. Now, that's a lot of touch points, but of equal importance, we have used telephonic communication in conjunction with the text messaging communication when appropriate or necessary. To date, we have conducted over 900 virtual visits with providers in our COVID virtual practice since we embarked on this journey. Next slide, please. So I wanted to illustrate what the monitoring assessment looks like. So the cell phone image to the far left reveals the daily assessment questions. So you can see it's a very simple questionnaire of COVID-related symptoms. So if an employee has no symptoms, which is the last choice at the bottom, they click the none and hit submit, and an image of all clear, that is in green with a timestamp and a date, pops up on their phone. Now, at our facilities, we do require employees to show this image as they enter one of our facilities, and that be either a place like Avenue North or one of our hospitals. We do ask staff to complete the assessment about an hour before their shift in order to capture any possible symptoms just prior to that shift. The cell phone scenario to the right reveals an employee who developed COVID-related symptoms. That is illustrated by a new cough. And with that response submission, a red, not clear alert signals, and with it a message that a member of the CareVO team will be reaching out to them shortly. With a red alert, a CareVO nurse will reach out to the employee via a text to get a better sense of the employee's symptoms and the severity of those symptoms. This is essentially a triage function to better determine if the recorded symptoms are COVID-related, and if a referral to the virtual practice or their own primary care doctor is needed for evaluation or referral for testing. Now, the reason for the triage is that we're in the midst of allergy season, so it's possible that an employee would wake up early in the morning and have a scratchy throat, maybe a sore throat, but by the time the CareVO nurse reaches out to them and assesses them, they've taken their allergy pill and their symptoms have resolved. So we do have the CareVO nurse does have the capability to manually revert a red non-clear to clear if that scenario should arise. Next slide, please. So when the red not clear alerts and triaging by the CareVO nurse really confirms that the new onset of symptoms are consistent with COVID, then the employee really should see a doctor. It could be their own doctor, but if their doctor is not available or the employee does not have a family physician, then CareVO can arrange for the employee to be seen by a virtual physician in our virtual practice. And that can be done really within minutes of the onset of their symptoms, considered an on-demand visit. So this virtual visit interaction is captured in the photo to the right of the screen. That's a physician with a employee or a patient who's going through assessment with a physical exam. Now, if CODE's done anything, it's really help us become expert using a platform, a video platform, to perform a physical exam and do an assessment. I will say that our virtual practice, primary care practice, has been in operation since for over 2 years, but we've really heightened our skill set and conduct these visits with ease. So while the patient is symptomatic, he or she can be enrolled in the CareVO ongoing home monitoring program. And to the left of the screen is the employee view of what ongoing assessment monitoring actually looks like. It's a very simple assessment with questions of, do you feel feeling better, feeling worse, or really unchanged from the prior assessment, and has some specific questions around COVID. Now, we have the ability to monitor with assessments every 24 hours, or we can push out the assessments up to 4 times a day. With each assessment, you can see in the little gray box, there are reminders of hand washing and social distancing and definitions about what that is, and also are embedded links with videos about Corona and how to stay safe in your community and at home. COVID positive employees are continually monitored for 14 days or until they're symptom free and meet the criteria for return to work based on either CDC guidelines and the DPH criteria. Next slide, please. So I just wanted to feature 3 salient functions of CareView monitoring. To the left really shows behind the scenes dashboarding with real-time notification of when an employee has failed screening or has developed symptoms. And you can see that by the red thumbs down. And the CareView team can thus respond very readily when this pops. So similar dashboarding is set up for ongoing assessments for COVID positive patients. So if a patient is having worsening symptoms, it becomes transparent on the dashboard by the same signaling of the red thumbs up, the red thumbs down or the green thumbs up if the patient is feeling improved. So this dashboarding really allows the nurse doing the monitoring to identify and prioritize those individuals who need immediate outreach and perhaps immediate medical services. It's a very simple visual that gives us that real-time notification. The mid portion of the slide really is to remind me that we have the assessment and our monitoring translated into Spanish. So both the COVID symptom screening and the ongoing assessments are translated in Spanish, and we have bilingual nurses and language services that support our programming. The far right of the screen just simply demonstrates a conversation thread using bidirectional text messaging and the ease of use of our platform. Next slide, please. So for those COVID positive employees who may be older or who have chronic diseases like diabetes, COPD, or are longtime smokers, we know that the risk for adverse events with COVID illness is higher. And so we have different pathways to risk assess and monitor more frequently those high risk individuals. And CareView will dispense pulse oximetry and thermometers based on risk criteria to better assess and respond to those medical needs of those individuals. Next slide, please. So in summary, the CareView COVID-19 Employee Monitoring Program offers several options for employee safety during the reopening of businesses in and around our state while the COVID-19 pandemic persists. CareView offers COVID screening for employees by screening monitoring to determine who is cleared for work on a given day or shift and who is not. A daily report is then sent to the employer. The program can also include on-demand virtual physician services, and the CareView Home Monitoring Program allows ongoing remote monitoring for COVID positive employees and eventual clearance for return to work according to DPH and CDC guidelines, as well as the clinical oversight of our virtual providers. So with that, completes my talk, and thank you. I think we now are going to transition to my colleagues, Dr. Patel and Bauer, to do their presentation.
Thank you, Doc. Yes, thank you, Dr. Jordan, for bringing something like CareView to our fingertips, because I feel like that really is going to help ease a lot of employers and employees as they transition back to being back in the workplace. I think we could. Both my colleague and I were really happy to be here, and I feel like as behavioral health specialists, we've been getting a lot of questions about, the anxiety revolving around returning back to the workplace. So I'm hoping that we'll be able to answer some questions for you and give you some tools for your toolbox to walk away from today. We could go to the next slide. So I think first and foremost, it's really important to just know that anxiety is valid. I feel like there was a huge spike of anxiety levels as we were transitioning from being in the workplace to being on quarantine, and transitioning our work offices into home offices. So as we kind of go back, just kind of recognizing that it's absolutely normal to be feeling this. It's how our bodies respond to any sort of danger. And like now that we're not in this quarantine, we're going back into areas where we would have more exposure or risk of exposure. We're definitely going to see this surge. And luckily, we have a lot of tools that have kind of come into place very quickly in the last couple of months. So I'm glad that we have that. As we're returning back to the workplace, there's in addition to like the loss of normalcy that a lot of people are experiencing, or as as well as the loss of loved ones to COVID-19, other losses to recognize is the loss of revenue. As businesses are coming back and trying to get back into business, that they have had this loss. There's a lot of anxiety around how their business is going to do, how they're going to make up for that lost revenue, and also because a lot of these places are not just being flooded with people all of a sudden, so it's important to acknowledge that. And then also the employees that are coming back, they've experienced a loss of wages as well, because they've either completely have not been working and or have been working limited hours, so they've had some partial loss of their income, which has impacted their family as well as themselves on an individual level. So I think it's important to know that these are all very anxiety provoking situations, and we're kind of moving into this unknown territory. And the most important thing that I cannot emphasize enough is to have good communication. There's going to be a lot of people that feel like, what they've experienced in these last 2.5, 3 months where they've been away from workplace, or those that have kind of still been working, on the front lines or kind of putting themselves out there. Everyone's going to feel like they've done something and they've overcome their own set of barriers and they've learned something. And I feel like it's important to kind of bring that all to an open communicating platform. And the more platforms available to them, the better. A few things that have worked for us in our workplace is having like huddles every couple of mornings, where even if it's like 10-15 minutes, kind of doing some sort of mindfulness activity to kind of bring everyone together and giving them a chance to kind of discuss whatever worries or conflicts or any things that are on their mind. And we're going to get to that in a little bit. We've actually started using Microsoft Teams and having like an open chat room throughout the day for all the people that are in the workplace, providers, managers, and front desk people for our clinic, but it could be anyone from their manager, employer, to the other employees that are working in and out of the actual workplace. It builds a level of comfort when you have a platform to communicate on, because you won't be interacting with everyone face to face throughout the day to bring things up, or like when you do see them, you might forget to bring something up. So if you know that you have this at your fingertips, it kind of gives everyone a chance to discuss any barriers or any emotions that they're having. Even give like positive, like shout outs to things or moments of success that they're experiencing as they're transitioning back, because that's just as important to make sure that it gets recognized. It gives a place for people to check in on each other if they know that someone's having a harder day or, struggling with something personally, like as they're transitioning from their kids being at home to now them being at work, and their kids like starting at other childcare place, or now that they're going to summertime, what's going on, summer camps and stuff are not all up and running like they might have been doing in the previous years. So, it gives them a place to even share like memes or support with a form of humor, because that is a great coping mechanism. And I feel like sometimes we forget that when times have been a little more darker and the clouds have been more gray recently. As we transition back to workplace, it's really important as employers to have all the appropriate PPE available for them, when it comes to just like soap dispensers being full, or hand sanitizer dispensers being full, or having them readily available, masks and all that, because that can really help employees have a more calming effect, a more comfortable feeling as they transition back. And it's really important to just kind of remember to not, remember that the do's and don'ts that we've been sticking to, they still continue. Just because things have been lifted doesn't mean we need to forget to wash our hands, use hand sanitizers with at least 60% alcohol, avoid touching your eyes, mouth, nose, and following the policies and procedures for cleaning and disinfecting, especially if there's going to be a traffic of people that aren't just working in the workplace, but other individuals that are going to be in and out of that workplace area, to be like frequently disinfecting and cleaning things appropriately. And, things that are touched frequently, like, keyboards, phones, handrails, doorknobs, are constantly being disinfected. And it's important to remember that if employees or employers are feeling sick, that it's important to stay home and make sure that they're getting clearance and stuff, before returning back to work. It's important to inform all supervisors, and if not just you are feeling unwell, but even if anyone in your family is experiencing any symptoms of COVID as well. So some signs and symptoms to really look out for when it comes to our individuals who might be struggling as we transition back is how they're performing. If you notice that their performance level is changing, their productivity is changing, they're starting to missing deadlines, or they're calling in sick frequently, or they're being absent, not just physically, but also mentally. They might be making it to work all right, but their mind is not really fully there. If you notice that they're struggling with making decisions and keeping focus and feeling that they're withdrawn from their work tasks, I think those are some red flags to watch out for, where you might want to kind of check in on them on the sidelines and or help them seek the help that is necessary. And we'll get to the more specifics of that in a little bit. There's actually programs online available for mental health first aid. And that kind of dives into what I just talked about in a little more detail, because of course, time is limited right now, but that really kind of walks you through how employers can help their employees should they notice any of these red flags. We could go to the next slide. So it's important to notice that, we're walking in with accepting that there's going to be hiccups as we transition back, and that mindset can be really helpful in conquering the things that were going to come up as barriers and obstacles. And if we could kind of foresee them before we open up our doors, I think it's important to kind of have like plan A, B, and C in place should they be necessary to be utilized. I think it's really important to recognize that the quarantine has led all of us to find the value and the possibility of working from home and seeing that productivity and progress is still possible. So if at all possible, if there is a flexibility with working from home or transitioning back slowly, in a graded format, I think if that's possible, allowing your employees to have a say can truly be comforting in how much they feel comfortable with coming back. Can they work part-time before they come back full-time and do some work remotely? Whatever the options are, I think to have that open communication with your employees can be very comforting, and and empowers them that they also do have a say in how things are transitioning back. I would encourage everyone to utilize all the resources that they have on hand. If you have a lunch break room, utilize that. Try to take lunch breaks, with social distancing, as a community in their workplace, because that's not only a good form of wellness, but it also allows individuals to kind of speak up about anything that they've been experiencing that day or that they need help with, even if it's something like, oh, we need a restock on, certain PPE or whatever that might be. If physical space is available, I know like at Christiana Care, we have some oasis rooms where there's like massage chairs and like soothing music and some like diffusers with aromatherapy. It allows people to kind of just get away and maybe get out of their heads for a few minutes before they could recollect their thoughts and get back to work, and allows them to kind of process everything that's going on. And we're going to kind of give you some examples of those 2-minute mindful activities down in a little bit. And I'm going to hand it off to my colleague, Dr. Bauer, because not only do we want you to have tools for your workplace, but also how to balance this with your family.
You can go to the next slide. Good morning. My name is Dr. Suzanne Bauer. I'm going to talk a little bit more about you personally, either in your home or with your family. It's important to continue to recognize that all of our employees continue to have a home life, and our home lives are so different now than they had been prior to COVID. So with our employees that have children, helping them talk to their families and talk to their children about the need for continued social distancing, washing your hands. Yes, we may be able to do some activities, but we can't necessarily do all activities. Explaining what's going on and what the change is to them in an age-appropriate way. So for those who have preschoolers, it's really important to use very simple and concrete language to address those children, and just let them know sort of simple do's and don'ts or rules. We still need to say, give some space. We're not ready to hug our neighbors yet. When we talk with school-age children, they have some basic understanding of germs. Don't sneeze on your friends. Kids kind of understand that. They're learning to sneeze into their elbows, wash their hands after they do that. But the nuance of how social distancing is being affected, moving back to work, and some activities that you can do, that's really complicated for them to understand. And the thing that those children are really missing the most are their friends from school. Schools are, for the most part, done for the year. And as Dr. Patel had suggested, most summer activities are really not going to be in session, or not in session the way that they normally are. So they're going to continue missing out on activities with their friends, birthday parties, going to soccer games, things like that. And to help them really manage that feeling of loss and sadness in an age-appropriate way. Then when you have teenagers, they really have adult language. They have a lot of adult understanding about what's going on. So they may be able to understand how these different rules are shifting over time, but they have other disappointments. Many of them have maybe missed prom or graduation. They missed a lot of really large end of the year activities in high school, and it was really just disrupted. Many kids think, high school is supposed to be the best time of their lives, and a lot of them just missed 3 months of that. Also, teenagers don't always make the best choices, even knowing the right information. So it's important to help them understand why it's important to continue social distancing, even though they're missing their friends. And that some of the restrictions have been lifted because we don't want to see a resurgence of COVID. So helping you talk with your families, or maybe even coaching your staff and how they can talk with different family members around the differences that are coming around with how we're addressing COVID is important. Like Dr. Patel had suggested, anxiety is still going to be very high. It has been high for many families in the midst of COVID and quarantine, and the anxiety is going to shift. So there's lots of different ways that you can manage your anxiety. People use things like yoga. There's so many different kinds of yoga. If you have children, there's also yoga that's designed for children that can be really fun to do as a family and to do together, to have an activity. Thinking about mindfulness. So mindfulness is sort of being aware of your experiences and accepting them so that you can manage your level of stress and anxiety and move forward in a thoughtful and purposeful way. One short example of a mindfulness activity and a grounding activity, sort of bringing you back from your anxiety to the here and now, is called the 3-3-3 activity. So you look around for 3 things you can see, 3 things that you can maybe smell or touch, and then 3 parts of your body that you can move. And focusing on those very concrete tactile things and activities that you can do sort of brings you back to the here and now and grounds you a little bit so that you can come back to being thoughtful and purposeful in your choices. So that's an important thing to do maybe in the workplace. It can also be really important to do when you're dealing with a stressful situation in your home, so that you can take a breath, calm for a second, and then address that situation head on in a thoughtful kind of way. Personal rescue boxes. These are, the idea of this is it's individual for each person, and they address all of the different senses, things you can see, touch, smell, taste, that you can feel, that they may be pictures of particularly meaningful moments in your life, but you collect these items that are meaningful to you and that are calming to you. So for certain people, maybe the smell of lavender is very calming, but for others, maybe it's the smell of lemon or something like that. So to bring those things together for each individual family member, that they have a touch point when they're feeling particularly stressed, to go back to their comfort items to help manage that anxiety. In talking about balancing roles in the home, Many people's roles in the home have shifted. So for a lot of families, for instance, a married couple, the one spouse has certain roles that they do within the home, and the other spouse has other roles that they do within the home. Due to changes with work, whether they're working at home, maybe they've lost their job, those roles have really shifted. And we need to take that into account, that maybe people have new or different responsibilities that they're still adjusting to in the home as they're readjusting back to work. And the best way to address that within your family is to just have a frank and open conversation about where you feel like this is going well and where you might need some help. Structure and routine in the home. So I have children. This is why this is really important to me. And I like to have a structure to keep my kids focused on what they should be doing. You know, they're not going to school anymore. So trying to keep a similar structure and routine for the day, but knowing that you have to be flexible about that. You know, it's summertime, the sun is out later, so kids don't want to go to bed exactly on time. That's all right. Structure is helpful to keep people feeling comfortable, and that there's some consistency and some normalcy, but too much rigidity around that just causes more anxiety and tension. You can go to the next slide. Balancing an office, a school, and a home all in the same place. So many of us have been doing that. School, for the most part, will be letting out soon, but many of us have had to develop a home office and a home with our family in the same place. Especially for families that have kids, it's important to have those rituals and continue those rituals. So you have your breakfast in the morning, you get dressed for work, and then you say goodbye to your family members and wish them a good day, and go to your separate office if you're able to keep your office separate. Especially with young children, that's super important, because then they realize there's a distinct difference between playtime and work time. And the reverse is true. When you come home, hi, I missed you. I had a great day at work. What did you do during the day? Maybe change into play clothes, so that there's that clear distinction and boundaries around the activities that you're doing. Physical differences in space are also important. If you can get yourself a little tucked away office that you can keep private, so that it's separate from where you have your family time, that's really important. And then thinking about additional resources. So we've talked about being able to reach out to friends and family members if you need support. Most of that's by phone at this point, or Zoom. As we're able to get a little bit closer and more in contact with people, maybe having some limited activities that you do with one another. And physical activity is really important. For the most part, gyms are not opening at this point, but with the weather kind of brightening up, then, you know, getting outside and moving, which actually leads us to the next slide. All of these ideas are important when dealing with stress. To get outside, not only the sunlight, but the vitamin D that you're getting from that is really beneficial for your body. Moving, whether it's walking, jogging, going for a bike ride, going hiking, whatever it takes and whatever your interest is, to get out and moving to help your body just get out there. Movement and exercise is really beneficial for your mood. Limit social media. A lot of us spend a lot of time on social media, good or bad. It's important to limit that to maybe 15 or 20 minutes a day, especially if you find yourself sort of gravitating towards negative or worrying aspects of the media, whether it's around coronavirus or other tensions that are in the media right now. You need to find a way to get the information that you need from a reputable source, and then move on to other things in your life. If you're focused too much on those negative or anxiety-provoking information sources, it can have a real detriment to your mood. Notice the good. There are lots of great things that are happening out there, and trying to absorb those as well. Helping others is a great way to feel a sense of accomplishment and to have a sense of pride. And then to take control. There are things that you can control in the environment. You can't control coronavirus, but you can definitely control aspects of your life, which also provides an anxiety relief. And then take stress in chunks. We all have a lot of stress in our lives. If you look at all of it, it seems insurmountable many times. If you address one little problem at a time, many of them are solvable, and it brings the stress down bit by bit. There's a link here for some additional exercises that you can do or you can share with your employees as ideas to help with easy stress relief. And then I'm going to turn it back to Dr. Patel for our last slide. Oh, you're still muted.
Yeah.
All right, sorry about that. Thank you, Dr. Bauer, for all that valuable information. I do want to add to the whole get moving thing, because I also have kids, and sometimes you are afraid to kind of take them outside because like it's hard to keep a mask on them or keep them from running around and like touching things, because that's kids. And we just have a dance party in our living room, and it's great exercise and the kids love it. And when it comes to like some of the mindfulness activities, like deep breathing is always been really great and recommended across the board for everyone. But like with kids, even like doing bubbles, it's a great way to kind of slow down our breaths and take control of our breathing, and it really helps with the anxiety, and the kids love it too. So those are, I just wanted to add those few little ones that I've just found really helpful in my own living room. And like we said before, there are going to be people that are struggling a little more than others, and it's important to recognize that you want to be a great support system, and that's really nice to have, but sometimes you do need to make sure that they get this professional help that they need. If you feel like they would benefit from it, it doesn't have to be something that they have to commit to forever, at least to kind of get in for an initial evaluation, at least to talk to someone. We have a few platforms that we've opened up given everything that's been going on. At Christiana Care, we have some group therapy support systems that are in the making and should be launching the next couple of weeks. And this will be like pretty different group therapies focused on different topics. One would be for individuals who have lost loved ones to the COVID, and obviously they are also trying to make ends meet financially, trying to get back into the workforce, but also experiencing this emotional and physical loss in their home, having lost a loved one. So that's going to be opening up like the grief support groups, as well as individuals who have maybe been, contracted the virus and have survived it. So they have a lot of things, like a lot of fear. It's like they already feel like, I caught it once. What if it comes back? Like, how am I going to be able to overcome all the symptoms? So that also has a lot of anxiety related to going back into the workplace. So having that platform to reach out, to be in a safe place to talk to other people that have also survived the COVID-19, having been infected. So that will be another group therapy topic. There will be other group therapies around just coping with coexisting during the COVID. So that's definitely going to bring in a lot of individuals. And then also substance abuse programs that are already in place and now opening up to those specifically that have noticed that their, alcohol intake has increased, or, started feeling some depression, and they've been self-coping with drugs versus seeking out the help, and sometimes just kind of giving them the information and be like, I think you would really benefit if you call and get the help, or at least get an evaluation to determine if you need to get any more intensive therapy or be on any prescribed medications that might help you. Because I feel like when you're feeling a lot of anxiety, or the depression is that has come on for a lot of people with the quarantine, our bodies respond to it by not eating well and not sleeping well. And those are the two main things on how we fuel our bodies. We can't expect anyone to run on an empty tank of gas, sorry. So, we want to make sure that we're feeling well rested and we're getting all the nutrition we need to conquer all of that we're trying to overcome, and all the barriers that are already in place. And as we kind of prepare to go back to it. So we have our Wilmington Gateway building Christiana Care Behavioral Health Office outpatient. That just gets us to a place where they could get in with providers. We have next day appointment available through multiple providers. Everyone's really opened up a lot of time and efforts to help our community, because this is definitely a very tough time. And it has been already, so this is just adding on to it. So we want to be able to help in any which way we can.
Wonderful. Thank you so much. We do have a few questions in the chat, and I know some of these went directly to the panelists, and Dr. Jordan did answer a few, but I am going to pose it to the group so that everyone can hear the answers as well. And if you have any questions, please feel free to put them into the chat. And this question was originally specifically to Dr. Jordan, but I think it also pertains to all three of you, and it's around HIPAA concerns. So as we are getting back to work in person, having these conversations, but also using products like CareVio, are there concerns that businesses should be thinking about in terms of HIPAA? Dr. Jordan, did you want to answer specifically about CareVio to start?
Yes, thank you. So from the CareVio perspective, yes, all our tools are HIPAA compliant. That's why we call it secure text messaging. We use a vendor who got that licensure. It's a special licensure with that is HIPAA secure. Also, we're in the health system, so all our documentation, all our conversations, our video visits are, again, all HIPAA secure. So there's not concern when it comes to the care delivery aspect or the querying and assessments that we use within CareVio for this monitoring or for the services that we provide.
And I just wanted to add, so there are, in addition to CareVio, behavioral health right now is using Zoom as a platform for telemedicine. We will be transitioning, and some of our groups may continue to use Zoom. That's also HIPAA compliant. The version of the platform that we use is for mental health providers, and so it's HIPAA compliant when we do therapy via Zoom.
Yeah, so that's as Dr. Patel said, it's a special licensure that has to go through that compliance, and the video portion, who's the vendor within our secure text messaging platform, is also HIPAA secure.
Perfect, thank you. There's also a question regarding to employer testing. You know, we're seeing a lot of conversation about, do you get your employees tested, and what's the process for that, and what are the recommendations for that? And I know, Dr. Jordan, you commented in the chat, but if you could share with everybody your thoughts.
Yes, at the present time, there is not a recommendation or no evidence to support asymptomatic testing of individuals. That is, those that don't exhibit symptoms. There's not the efficacy to test them at this point in time. The conversation continues, and we see some variation of that across states. I think it'll come down to how good is our testing. It needs to be FDA approved. There's a lot of variability in the testing, thus we get false positives and false negatives. The whole antibody testing around IgM is confusing and not sure what that data actually means for us. So at this point in time, it's not recommended to test widely asymptomatic folks. I know within our own state, we are testing hotspots. So where there's been an outbreak and those communities maybe don't have resources, or the state has gone in and offered testing to see is how communicable within that testing site or hotspot are individuals, and giving them support. So I think much more to come on this. I think the testing will improve. And as you are probably aware, one of the issues with testing is around the reagents that are needed for the testing. So until we can get those resources and distribution back up so we can have universal testing, it's going to be an issue. And we need to think about procuring resources wisely and using it for those cases that we have questions with symptoms around COVID.
Okay. And actually, there's a follow-up that just came through about the testing. Are there any that are currently FDA approved?
I would have to research that at this point in time. I don't want to comment. And I certainly wouldn't want to disclose yeah, I don't know at this time.
Gotcha. Thank you very much. Dr. Patel, you were sharing a little bit about, and this is something that we've heard a lot is, if you are sick, stay home. And if people are not salary workers, and I know even pre-COVID, people would go to work sick all the time because they were fear of losing hours, losing income. So do you have any recommendations for the employee, but also the employer on handling those conversations when people are maybe not feeling well, but they're just like, oh, I don't think it's COVID. I should probably still go in. I don't want to lose my hours.
Right. So I think that's why it's important to have that communication, like, a platform to make sure you have a clear communication with your supervisor, where if there's another way for it, they could work remotely that day until, like as Dr. Jordan said, sometimes it's just allergies that maybe you're not sure what's going on. And if we could just give a couple hours for it or a day or so for it to figure out what's actually happening, I think it just puts all the other people in the workplace at ease, as well as you or yourself at ease, because you know that you're still able to be productive, because it's not like you've come down with something where you're like bedridden, but just also keeping everyone safe, including yourself, just in case there is something that is brewing.
Thank you. And then Dr. Bauer, first of all, I think the advice of don't sneeze on your friends is fantastic. That was great. I wrote that down. For people who are working from home and maybe they are single parents, or one of the parents does not work within the home, they are actually, at their location. Do you have recommendations for people that can't tuck from their kids? They can't have a separate office, and they're can maybe structure a little bit that way they can assist their children, but then also still be able to get some work done and feel like they've accomplished something throughout the day.
Sure. Yeah, I think first of all, communication with your employer is going to be key, because if you are really needing to manage your children while you're working, you're now working 2 jobs at the same time. So understanding some flexibility with your employer, and can you maybe expand your work hours so that you can do your work in chunks? You can do your work a little bit, take a break, help your children do something, go back to your work. It depends a little bit on the age of your children. I have fairly young children. My oldest is 5.5. That's where I got "Don't sneeze on your friends." She taught me that. That was nice. But, my kids like to have a little workstation next to me when it's something that I can do with them. Obviously, there are meetings or there are therapy appointments that they can't be present for. And so I need to have activities for them to do. And those are at predetermined times. But at other times, if I can do my work and they set up their little pretend computers next to me and we do our work together, it can be a family time. But then I often do work after they go to bed, because I do need to complete what I have to do to be productive. So trying to do all of those things at the same time, but helping your employer to understand what your limits might be and what your constraints are personally.
And we've got another follow-up question, which it was directed at Dr. Patel, but then it also, what you just said, Dr. Bauer, it also kind of connects to that. A lot of people are throwing themselves into their work right now and working much longer hours. And maybe it's because they, have children at home, so they feel like they need to do more tasks later. Or maybe it's just because when your office is at home, you never get away from the office. So do you have any thoughts or recommendations around that and the burnout that could potentially come from that by not taking the downtime?
So I can go, and then Dr. Patel as well. So sorry, I know you both wanted to jump in. I think that's part of where like the boundaries and structure is really important. My commute went from being almost an hour to being approximately 30 seconds to get down the stairs. And so, but that makes a big difference. I used to take that time to listen to the news on the radio or my favorite music or something and decompress before I got home from work. And I don't have that anymore. It's really easy to be checking my email on my phone all night. And so we have some certain rules at home, like you don't bring a phone to the dinner table. When we have family time where we're getting ready for bed, you don't bring those things with you. And so I think having some family discussions around how you set some structure for yourself is important. And then Dr. Patel, you wanted to.
Yeah, no, I feel like self-care is really important. COVID or no COVID, it's always something that's been stressed. There was levels of burnout even prior to all of this. So there have been a lot of things in place that is, that have been recommended to prevent that from happening. And I think it's important that, like Dr. Bauer said, to have some space that's yours or some time that's yours. If you are, if you do, like you said, have a spouse that's working outside of the home, like when they're home, like, you kind of get to clock out for a little bit and do some self-care. So it's important to maybe like within the same home, even if it's like, for everyone to have a little bit of their own space, whether like for your kids, it's like on a beanbag chair or under the table in a fort, or, so like even one corner for everyone, like for every individual, where you have like your personal rescue box where you could do your own activities that are for yourself, for your own self-care, and then maybe doing things as a family, like, getting outside and getting some sunlight, going for a walk as a family, and really unplugging, like Dr. Bauer said, like being away from all the things that are going to be dinging on your phone. There are like kind of clocking out when you're clocking out, not just because you're at home, you're like not working through the night. But of course, if you're doing like home care stuff during the day and you're doing more of your work at night, it's hard to do that. But just even finding 15-20 minutes a day to do that, just the individual time where everyone can kind of do their own individual time, and then the family time where you can kind of come together and even discuss how you guys enjoyed your individual time, and maybe get everyone involved on each other's activities of interest every so often, kind of really like, so 15 minutes of that and 15 minutes of that's 30 minutes a day. I think we could definitely do that for our own mental sanity.